Hello friends, welcome back to my channel Medicine of Anziron. Today we'll talk about extracellular edema. Okay, so let me tell you that I have already uploaded one video that is based on the intercellular edema, where I said we'll get the intercellular swellings. But in these cases, I'll talk in terms of the extracellular edema. That means if we just define the term in terms of the extracellular edema, we'll get the accumulations of the fluid outside of the cells, right? So outside of the cells means in terms of the interstitial space and in the serous cavity. Okay, so if we write it over here, if we just define the term that accumulation of fluid within interstitial space and serous cavity. Serous cavity means you can remember in terms of the pleural cavity, the pericardial cavity in this way. So whenever we get the accumulations of the fluid, these are the cells, right? This is the normal. I have just taken hypothetical tissue. This is over here. It is left heart. From the left heart, as you know, the blood that will be pumped, and from where we will get the blood that will be circulated in the different tissues. And from here we will got, there is the capillary, and here we got what? This is the venous windings. So from here we will get the veins, and ultimately we will get the blood that will be reached systems. Then ultimately the blood that will be reached within the right heart. Okay. Then again from here we will get the blood that will be circulated to the lungs. From lungs we will get the blood that will come to the left heart. We can say the left atrium. As you know, normally is the normal thing. Okay. Now here in these cases we will get the accumulations of the fluid within the interstitial space and the serous cavity. That means we will get the, for example, accumulations of the fluid within the interstitial space here. Now, as we know that try to understand, whenever the blood that will be pumped by the left heart over here, this blood that will reach over here, ultimately will get the, from the artery to the small artery, then the arterioles, then we'll get the capillaries, right? So whenever the blood that will reach over here, try to understand from this figure, the blood is reaching over here. Now, whenever the blood that will reach over here, this blood that will supply the different kinds of the nutrients, oxygens to the tissues, to the cells, right? Now, whenever we are saying in this way that we'll get the supplementations of from here we'll get the, for example, we're getting the oxygens, we're getting the different kinds of the nutrients. For example, we can say in terms of the glucose. Okay. Now these things will be supplied over here. Okay. Now, along with that, we will see whenever the fluid that will reach from here to here, through the fluid, definitely the the nutrients, the oxygen molecules, they will reach over here. Now try to understand whenever we will get this fluid that will reach from here to here. Along with that, we will see sometimes a very little amount of the protein that can reach over here also. Sometimes, not always. So over here, sometimes we will see little amount of the protein. So this is a protein. So protein can reach over here, but whenever the protein that will be, whenever we see the protein that will reach over here, at that time we will see, okay, these proteins that will be circulated back, or we can say the sucked back by the lymphatic systems. So here we get almost thing over here. There's the lymphatic drainage, right? So we'll get the lymphatic drainage, for example. So from the lymphatic drainage, ultimately we'll see that will reach to the venous system, right? This is the lymphatic drainage, this is the lymph. Now we'll talk about the mechanisms, how we're getting why the fluid that will rush, why we will see the fluid that will go from the from the microcirculations to the interstitial space. Now see, here basically we'll talk about the Starling forces. What is Starling forces here? Two types of the forces we'll get. One is hydrostatic pressures and another is oncotic pressures. Okay, then it will be clear, I think, and it will be easier for you to understand. The blood that is coming from the left heart, ultimately try to understand whenever the blood that will reach over here, we'll get the presence of one type of the pressure that is known as what? Hydrostatic pressure. HP means hydrostatic pressure. Okay, I'm writing it over here. Hydrostatic pressure. Okay. So now see, at the beginning of, try to understand, at the beginning of the microcirculation, or we can say the capillaries, the hydrostatic pressure that will be much more. So whenever For example, we will get the hydrostatic pressure. I'm just taking for the, the ideal tissue over here, 35 mm of Hg. Okay. Now, whenever the hydrostatic pressure, that will be much what its function. The hydrostatic pressure that will push the fluid towards the tissues. That will push the fluid towards the tissue, right? Towards the tissue, or we can say towards the cells. Now, along with that, we will get, see, whenever the fluids that are coming over here, this fluid, they will be not accumulated over here, right? Because this fluid, they will supply in these regions. They will supply the oxygen, they will supply the nutrients to the cells. After that, this fluid that will be sucked back. This fluid that will be what again? Sucked back. Now this fluid that will be sucked back, or you can say that will be the fluid that will be pulled back again for the presence of what? For the presence of, we can say, osmotic pressure or oncotic pressures. I'm writing it over here. OP means, we can write osmotic pressure. So what is osmotic pressure? See, as we know, within the circulation, within the plasma, there is the presence of different kinds of the protein, especially in terms of the albumin, globulin, and the fibrinogens. Now they are having the capacity to hold the water molecules, right? They are having the capacity to hold the water molecules. Now whenever the fluid that will reach over here, okay, because of the presence of the protein molecules within the circulations, we will get the osmotic pressures over here. And these osmotic pressures that will suck the fluid, that will, at first for the hydrostatic pressure, we will see the fluid that will come over here. Okay, and then whenever the fluid they will supply, whatever it is supposed to supply over here, after finishing the supplications over here, supplementations, we will see these osmotic pressures that will suck back the fluids again. So the osmotic pressure, whatever the thing we will get over here, the osmotic pressures suck the fluid. Okay, again. Now see, whenever we will see the blood flow through the microcirculations, okay, as it continues, we will see, progressively we will see the hydrostatic pressure that will keep on decreasing. So for example, if I just draw the borderline over here, we will see the hydrostatic pressure that will keep on decreasing. For example, the osmotic pressure I am just taking over here, in these cases from the first portions I am taking in terms of 25 mm of Hg. Now see, the hydrostatic pressure that is trying to push the fluid within the water, the hydrostatic pressure that is trying to push the fluid within the interstitial space, along with that within the cells. Now the oncotic pressure that will not let the fluid to go from the microcirculation to the interstitial space. So what I am saying, try to understand, the hydrostatic pressure that is pushing the fluid from the microcirculations to the interstitial space. Along with that, we will see the presence of the osmotic pressures for the presence of protein within the circulations. These osmotic pressures, or you can say the oncotic pressure, that will not let the fluid to go from the microcirculations to the interstitial space. But in these cases, if we see that pressure differences, see here we are getting the hydrostatic pressures around how much? 35 mm of Hg. And in cases of the osmotic pressures, for example, we are getting over a 25 mm of Hg. So we are getting the difference for 10 mm of Hg, or so 10 millimeter of mercury. As we are getting the hydrostatic pressure that will overcome the osmotic pressure or the oncotic pressure, as a result we will see the fluid that will reach from the microcirculation regions or from the capillaries to the interstitial space. Okay, so here in these cases we will get first hydrostatic pressure that will be greater than osmotic pressure. These are the Starling forces. Okay, now after that we will see whenever it will be supplied, the fluid already came over here. After that, as I said, as the fluid that will progressively going in these directions from the from the what we can say the arterial part to the venular part over here. As a result, we will see the hydrostatic pressure that will keep on decreasing. Hydrostatic pressure that will keep on decreasing. Okay, and the oncotic pressure, there will be no change in the oncotic pressure, because try to understand, whatever the protein it was over here, the same amount of the proteins, that the presence of the same amount of the protein will also get over here. As a result, we will not get any significant changes in the osmotic pressure. It will remain same. So if you write it over here, the osmotic pressures that will remain same. It will be normal. But the hydrostatic pressures, we are getting what? Hydrostatic pressure that is getting reduced, right? So let me show over here the different color. Is the same, the 25. And for example, we are getting the hydrogen right now from from 35 to we are getting 20 mm of Hg. Now as a result, or we can say in terms of the 50 hydrostatic pressure, we are getting 50 millimeter of mercury, here 25. Now see, the osmotic pressure is getting increased over here, okay, and the hydrostatic pressure that is getting over here. Now as the oncotic pressure that will be increased, so what it will do, it will suck the fluid, whatever the fluid that has reached within the interstitial space, this fluid that will be sucked up by osmotic pressures. Here in these cases we will get the osmotic pressures, in these cases that will be greater than the hydrostatic pressures. Okay, that will be greater than the hydrostatic pressure. Now this is the normal mechanism. This is the normal mechanism under normal physiological circumstances. Okay, we can see this type of thing. Now sometimes you can see, as I said to you before only, that sometimes we can see along with this hydrostatic pressure, whenever it will push the fluid, along with the fluid, some amount of the proteins may come over here. So whenever the proteins that will come over here, as the osmotic pressure or oncotic pressure, they are not able to take the proteins within the circulations. They are having the capacity to take the fluid along with them, but they are not having the capacity to take the protein within the circulations back again. So as a result, we will see for these proteins, we'll have the lymphatic drainage. So the lymph that will circulate back the proteins. For example, we can get a very little amount of the protein over here under normal physiological circumstances. So the lymph, for example, we are getting the protein. This protein that will be pulled back by the lymphatic systems. Again, it will be sent to the venous systems. Ultimately, it will reach within the general circulation. Now, this is the normal mechanisms. Now, why we will see the development of the extracellular edema? That's the most important thing we need to know. Why we will see the development of extracellular edema? Extracellular edema. Okay. Now see, what other thing we'll get over here. For whatever the regions, if we get the hydrostatic pressure that is getting increased too much, if we get the hydrostatic pressures that is getting increased, okay, or whenever the hydrostatic pressure that will be increased, try to understand from here, the more amount of the fluid that will reach from the microcirculation to the interstitial space. So whenever we will get the more amount of the fluid, so more fluid will get within the interstitial space. One thing. Okay. The second region, if we get, the fluid suck, if we get the sucking of the fluid back again within the circulation less. So for example, if we see the dropping of the osmotic pressures, so dropping of the osmotic pressure, as a result, the fluid sucking or sucking of the fluid that will be less. So whenever the fluid sucking that will be less, definitely we will get the accumulations of the fluid over here. Okay. Now the third region, we can say, if we get the lymph is not functional, if we see, for example, whenever we are getting the hydrostatic pressure is getting increased, as a result we are getting the more amount of the fluid within the interstitial space. So the lymph that will try to push back the fluid again to the general circulations. For example, if we see the lymph is not functional, so we can write it over here in this way, that less drainage by the lymph. So if we see less drainage by lymph, less drainage by lymph. So whenever the less drainage, you will see definitely, so it is not able to drain that much of the fluid, how much is coming. So as a result, we will see the accumulation, the tendency for the fluid accumulations here, that will be much more. And the number 4, if we see the permeability in between, for example, if we see the permeability through the endothelial cell gaps, if we see the permeability through the gap of the endothelial cells is getting increased, so more amount of the fluid will be reach within the interstitial space. So the fourth region we can say over here, that if we get the permeability that is getting increased, as a result we will get this other thing. Okay. So these are the regions for what we will get the development of the edema over here. Now we'll talk in details. Okay. So why the hydrostatic pressure that will be increased? So as I said, these are the regions. Now I'll just go in details about each regions in details. So for example, whenever I was saying that hydrostatic pressures, if I say the hydrostatic pressures over here that is getting increased, so what are the regions that will increase the hydrostatic pressures? So first, if we write it over here, that why we will get the increased hydrostatic pressure. So first point, if you write what are the regions that will increase the hydrostatic pressures. Now for whatever the regions, try to understand if we get the vasodilations over here. Now whenever we get the vasodilation in this region, so more amount of the fluid that will reach from here to the arterioles, from the arterioles to the capillaries. So whenever we get the vasodilations, more amount of the fluid is going with the microcirculations. I am repeating once again, for the development of the vasodilations, we will get the more amount of the fluid that will reach up to the microcirculation. So whenever more amount of the fluid is going in these regions, definitely from here it's very easy to understand the hydrostatic pressure that will be increased. So first region we can see over here, if we see the vasodilation, if we get the vasodilation, one thing. The second region, for example, if we get any kind of the obstruction within the venules over here, if we get the obstruction within the veins, or if we see the resistance for whatever the resistance, if we see the resistance within the venules that is getting increased, so whenever the resistance within the veins, within the venules over here, that will be increased, so definitely more amount of the fluid we can say within the microcirculation that will long lasting. So whenever the fluid that will long lasting, definitely it is not letting the fluid pass properly. As a result, we will get the accumulation of the fluid over here, so that will lead to the increase of the hydrostatic pressure. So if we get here the obstructions, or you can say the resistance, so you can write it over here. If we get the venoconstrictions, okay, another way you can see, if we see this region is getting constricted or we are getting obstructed, so the second region we can see over here, the venoconstriction. If we get the venoconstrictions or the obstructions, if we get over here, that will lead to the increase of hydrostatic pressures. So whenever the hydrostatic pressure that will be increased, try to understand. So less amount, more amount of the fluid that will reach over here. So more outflow of the fluid from the microcirculation system to the interstitial space. Okay. Now, second region, if we see the oncotic pressure that is getting decreased. Now, what are the regions? While talking details. So the second region, if we see the oncotic pressure that is getting decreased. Now, why the oncotic pressure that will be decreased? Now, the existence of the oncotic pressure is because of the presence of the proteins, right? For whatever the regions, if we see within the circulations or within general circulations, or we can say over here the microcirculations, if we get the protein level is reduced, if we see the protein level that is getting reduced, so whenever the protein level that will be reduced, definitely the oncotic pressure that will be also reduced. So whenever the oncotic pressure that will be reduced, they will be not able to take back the fluid again within the microcirculation. That's the problem. So if we see over here, let's write it these things over here. So the main region we will get over here, if we get the plasma protein concentration that is getting reduced, plasma protein concentration that is getting reduced, as a result we will get the less amount, less value, or we can say the less amount of the oncotic pressure. In terms of the plasma protein, we have to know a little bit. We can say in terms of the albumin, globulin, fibrinogen, right? It's a very easy thing, so all of you know it. Now, as you know that the presence of the albumin, or you can say the value for the albumin is the most, so here we will get from 3 to 5 gram per day. Okay, so albumin is the main, albumin is having the, you can say the main role over here to just hold the water molecules. So as we said that because of the presence of the plasma protein, they will just hold the water molecules within the circulation. So whenever we are getting this all plasma protein concentration getting reduced, so whenever it will be reduced, try to understand the oncotic pressure that will be also reduced. Okay, what are the other regions? Okay, let's talk about those things also. Globulin level, if you want to remember, you can remember from here. It's 1.5 to, I think, yes, 1.5 to 2.5 around. You can remember if you want to remember this thing. 2.5 gram per deciliter. Okay. Now we'll talk about what are the things we'll get over here. Why we see the development of the less protein over here. For example, if we see the development of the nephrotic syndrome, if we see the development of the nephrotic syndrome, so through excretory systems we will see the, here we get the development of the hypoalbuminemia. Hypoalbuminemia. So whenever we are getting the protein, Productions of the hypoalbuminemia, at that time definitely the albumin level that will be reduced. So whenever we will get this type of thing, the osmotic pressure definitely that will be also reduced. So this is the reason we can see over here, this type of the problem. Now the third reason I said, if we see the less drainage by the lymphatic system, I will go back in details again for these things, for the osmotic pressure why it will be reduced. Okay, but for now just I will know up to this much. I will go back in details in the next video whenever we will talk in terms of the in details of the nephrotic syndrome. Okay, now the third reason we can write it over here in terms of lymphatic drainage. So if we see the lymphatic drainage, okay, if we see the lymphatic drainage that is getting reduced, whatever the problem we will see over here. So let's talk about those things. Now, as I said you before, that whenever the lymphatic drainage that will be less, now see, what did I say under normal circumstances? If we see the hydrostatic pressure is getting increased or the osmotic pressure that is getting reduced, in these cases we will get the fluid accumulations within the what? The fluid that will come where within the interstitial space. But there is a lymphatic system. This lymphatic system, they will try to suck back all the fluids. But sometimes we see the hydrostatic pressure that will be increased so much. See, in some cases we will get, try to understand from here. From the normal concept, we can see over here, or some students they can ask like these things, that whenever the hydrostatic pressure that is getting increased or oncotic pressure that is getting reduced, so definitely we are getting the accumulations of the fluid within the interstitial space. But there is the what? We can say the alternative way, just to suck the fluid back again, there is a lymphatic system. But sometimes the hydrostatic pressure that will be so much, try to understand from here, the hydrostatic pressure that will be so much that the fluid within the interstitial space, the fluid will be so much that these lymphatic systems, they will be not able to suck that much fluid. How much? Here we get the accumulations of the fluid so much that this much fluid that cannot be sucked properly by the what? Lymphatic system. The lymphatic system, they will be overwhelmed. We can say over here. Okay. So we can say the accumulations of the fluid. We can say the accumulations of the fluid for the increasing value of the hydrostatic pressures over here, that will overcome the function of lymphatic drainage. So as a result, we will see the accumulations of the fluid in these regions, and that will lead to the formation of edema. Okay. Now the third region, yes, as I was saying you, that whenever we will get the lymphatic drainage, so lymphatic drainage, whenever it will be reduced, try to understand, as I said you, that whenever for the presence of the hydrostatic pressures, some amount of the protein that will be sent, or that will be pushed, some amount of the proteins that will be pushed from the microcirculation to the interstitial space. So what did I say you? That for the presence of the hydrostatic pressures, we will see some amount of the proteins that will be pushed by the hydrostatic pressure from the microcirculation to the interstitial space. But this much proteins that will be sucked back again by the lymphatic drainage over here. But for whatever the regions, if we see the lymphatic drainage that is getting reduced, at that time whatever the problem we will see, this protein, for example, these proteins are coming over here, and these proteins, very little amount of the protein, as I said, that will come over here. But over months and years, we will see this small amount of the protein that will keep on accumulating in this way, and as a result, we will see the accumulations of the protein there will be so much that it will be able to hold too much water molecules along with it. So whenever the protein that will accumulate too much, molecules of the water over here, will get the development of the edema. Now, for example, if we see there is any kind of the obstructions, for example, if we get any kind of the obstructions over here within the lymphatic drainage, if we get any kind of the obstruction, so whenever we are getting the obstructions, or for example, if we get, for example, anybody or any individual who has developed the breast cancer, so the cancer cells that can come over here and that can destroy or that can block also the what? That can also block the lymphatic systems. So we can say, for example, that in terms of the, if you see the cancer cells that can come over here, and some kinds of the parasite, these parasites, some parasite, they can also cause the problem that within the lymph. So whenever we see the for these regions, we can get the obstructions, we can get also the infiltrations of the cancer cell, we can get also the parasite attack over here, As a result, we will get the lymphatic drainage that will be reduced. So whenever the lymphatic drainage that will be reduced, try to understand, we will get the protein that will be accumulated over months and years over here. So whenever we will get the accumulations of the protein over here, they will be able to hold the water molecules along with them. So ultimately we will get the development of the edema. Now we will get the two types of the edema you have to know over here. One is known as pitting edema and another is non-pitting edema. Pitting edema, non-pitting edema. Now see, if we see from here, try to understand how can we define the pitting edema. For example, there is, for example, I have developed the edema over here, swollen part. Now if you push, now see, if I just apply the pressure on the edema, try to understand, if I apply the pressure on the edema, we will get a depression over here. Whatever the fluid was over here, it will be displaced from here, it will go to the another regions. So from here, the pitting edema, if we just press on it, it will be soft. And when you just push pressures over it, we will get a depression. Now, in terms of the pitting edema, definitely it will be developed for increase of the hydrostatic pressure, decreasing value of the osmotic pressures. So basically, we will get the main component of this. Pitting edema, we will get the fluids. We will get the fluid over here. Now, in terms of the non-pitting edema, try to understand. If we say in terms of the components of the non-pitting edema, before that, let me show you guys. For example, here I have developed the non-pitting edema. If I just push, if I just apply the pressure on the non-pitting edema, it will be hard, not soft like the pitting edema. So it will be hard. And if we see the depression, we will not get that much depression like the pitting edema. So first of all, it will be soft. Sorry, it will be hard. It will be hard. Now in these cases, when you will see the development of the non-pitting edema, now see, whenever, for example, if we say in terms of the non-pitting edema, whenever we are getting the development of the lymphatic system blockage, if we get the obstructions within the lymphatic system, so whenever we are getting the obstruction within the lymphatic systems over here within the lymphatic drainage, so definitely they will get the accumulations of the protein within the microcirculations. So within the microcirculations, whenever we are getting the protein accumulations, they will just hold the outer molecules and they will form the edema. Now in these cases, we are getting the edema formations. There is the presence of protein molecules along with the presence of fluid. So in terms of the non-pitting edema, we can say there will get the outer molecules, along with that we will get the protein. You get the protein. So in terms of the pitting edema, we will get the only fluid, outer molecules we can say over here. In terms of the non-pitting edema, we will get the outer molecules and protein. Now, that's why whenever we just say in terms of the treatment, if we use the diuretics over here, well, in terms of the pitting edema, we will get the, symptomatic changes. But in this case, if we use the diuretics, we will not get that much changes. So I try to understand. Whenever we are using the diuretics in terms of the pitting edema, the diuretics, they will remove the, extra accumulations of the water molecules of the fluid from these portions, for example. But what about the non-pitting edema? In case of the non-pitting edema, they will be able, as the diuretics are having the capacity to only remove the water molecules, not protein. So these diuretics, they will remove the water molecules from here, but not the proteins. But we will see this still the protein that will be over here. As a result, we will see again, we can see the accumulations of the fluid along with this thing. But if that's why, if you use the diuretics in terms of the pitting edema, it will be helpful. But if you use the diuretics in terms of the non-pitting edema, it will be not that much helpful, because in these cases the diuretics that will be able to remove the water molecules from these regions. But in these cases, these diuretics that will be not able to also remove the protein molecules, the protein that will be still within the interstitial space. Now whenever the protein that will be existed over here, again it will just accumulate the water molecules, again it will develop the edema. So that was all about in terms of the extracellular edema. There are also some clinical correlations. I'll talk on the next part. Okay, what kind of the drugs, how can we just manage this type of the thing, and the one more important parts that is known as dependent edema. I'll talk about all these things in the next part. Okay, thanks for watching. If you see this video helpful for you, please do like and subscribe my channel, and see you in the next video very soon. Thanks for watching.